I am Dan Theodorescu. I'm a urologist, urologic oncologist by training, and I am now the Cancer Center Director at the University of Colorado. I think the conference has been spectacularly well organized. I think it's a major addition to the conferences on bladder cancer that we have. Of course, in bladder cancer, it's a very exciting time for the field because of novel therapies and novel biomarkers, and really a fundamental shift in understanding of the disease. So having these types of meetings, especially bringing together academic and community practice physicians, is really very productive and very stimulating. Our laboratory has been working in bladder cancer, molecular biology, gene discovery, and experimental therapeutics for the past 20 years. We've developed a number of biomarkers that are now in clinical trials, as well as developed new drugs that are being developed by pharmaceutical companies. And so in my presentation, what I'm going to do is summarize the field very briefly with a few vignettes of how we have now evolved from empirical medicine to precision medicine, and as I said, give a few vignettes with urological examples, how we have predictive markers, prognostic markers, as well as new therapeutic targets, all of which have been really derived from our deep understanding of cancer biology, which has been driven by the genomic revolution, if you will, and sequencing of the human genome, and as well as many other technological advances that have allowed that, such as next generation sequencing, gene expression, and other technologies. So our laboratory has been focusing on understanding the underlying biology of bladder cancer, and in doing so, we've identified a number of biomarkers as well as therapeutic targets. One therapeutic target is called RAL, and it's part of a GTPase family, which is a large family of molecular switches, if you will, and traditionally they've been very difficult, very difficult or impossible to drug, and we discovered a novel way of finding agents, again, this particularly GTPase called RAL, but I think these technologies could be applied to other GTPases, allowing the possibility of drugging an entire, or many of this large 60+ gene family of GTPases using our discovery. So our RAL drug has now been licensed to a pharmaceutical company who's developing it and optimizing the chemical structure, as well as doing all the preliminary toxicity studies, etc., with the hope of eventually going into phase 1 clinical trials.